When I was growing up, my parents always reminded me of a few rules in our home.
Don't jump on the couch. Eat all your vegetables. Don't do drugs.
Drugs? What were drugs? Thinking like a child, I knew that marijuana was a drug, and that white powder stuff was considered a drug, and that was about it. My mom never told me.
Don't take hydrocodone. Stay away from that fentanyl.
Even though these are just as dangerous as deadly street drugs. Tyler Conley, a 24-year-old male who started taking painkillers at 15 years old, tells us his story.
I tried a couple of painkillers because at that time I thought they were safer because they came from the doctor. I was taking them daily because I was bored at school, and the feeling I got from that was I kind of fell in love with it.
Tyler is just one of the many children and teens in America to experiment with prescription drugs and is living proof that this is a growing problem. I bring up this topic because an opioid epidemic has hit American adults, and now it's making children its next target. A recent study by the American Academy of Pediatrics has shown that on average, 135 children per day are testing positive for an opioid addiction or dependence in America, with numbers rising from a total of 32,235 in 2008 to 49,626 in 2013. The trend is steadily increasing and may soon become a public health crisis. So how do we start addressing the problem? What even is the problem? The problem is that there is an increased risk of opioid overdose or death among young people related to the increased use of prescription painkillers. There are many terrible symptoms of opioid overdose. Subjectively, patients may begin to feel very relaxed, nauseous, confused, delirious, being unaware of themselves, the time, the place, or setting, and may lose consciousness temporarily. Objectively, the symptoms of overdose may include respiratory failure, slow and shallow breathing, small pinpoint pupils, unresponsiveness, vomiting, blue skin from poor circulation, and may result in death. Children and teens should not be overdosing on prescription painkillers in America, let alone any other country. So what should we do to prevent this from happening? A recent study examined the effects of early intervention for addiction in adolescents and suggested that pediatricians provide screening services as well as pharmacotherapy options to treat addiction for teenagers and young adults with opioid use disorder, also called OUD. Pediatricians are most likely the only doctor that patients age 21 and under will visit, so educating the pediatricians on how to handle opioid use disorder will help the pediatricians educate and treat their patients with addiction. Pediatricians have been slow to treat patients with opioid use disorder because no organization supported the use of pharmacotherapy. In August 2016, the American Academy of Pediatrics was the first to issue a statement of support of pharmacotherapy to treat opioid use disorders in teenagers and young adults. Evidence-based nursing practice indicates that offering medications early in the life course of severe addiction is critical to prevent downstream harm from addiction. Pharmacotherapy has treated many adults with opioid use disorder, and pediatricians should be willing to try pharmacotherapy to treat teenagers and children with addiction. By implementing a public policy for pediatricians to screen and provide treatment for opioid use disorders, we may see a decrease in the number of children who are addicted to opioids and in the number of overdose deaths. Additionally, if these screening tools and treatment guidelines are put into place, it may drive pediatricians to embrace pharmacotherapy for opioid use disorders in a more timely manner, therefore having the greatest impact on children's health.